Hi everybody, I'm Dr. David Dana and I am here today with a very dear friend of mine, Dr. Mario Flores. Dr. Mario Flores has been a friend of Progressive Orthodontic Seminars for 25 years. He actually graduated from Progressive Orthodontic Seminars in the Orange County number 5 class a year before I did. So it's been 25 years since Mario became a friend and family at Progressive Orthodontic Seminars. Mario has a very long story. After he graduated from Progressive, he maintained his private practice doing general dentistry and ortho. Then Mario entered Loma Linda University for training in perio and implants, and conscious sedation as well was part of your training. 4 years at Loma Linda University. And after graduation from his perio implant training, he ended up being part of the faculty, and he's been part of the faculty until this day. During these 25 years or more, Mario has always kept a private practice, not only perio practice, as he is a periodontal specialist, but also a general dentistry practice where he used to also do orthodontics and keep up with what he learned here at Progressive. Mario also is our chair of the perio department at the Magan International School of Dentistry at Primas University in Indonesia, which is a big job, and he's doing a fantastic job. Mario also teaches for Magan Postgrad, the perio courses, and some of the implant courses. Mario, it is a pleasure having you with us today. And I just want to talk to you a little bit about what you do with general dentist in perio.
Sure. Well, thank you for inviting me. It is an honor for me to be here.
One of the things that I would like you to tell us a little bit about is when you're talking about aesthetic perio, this is a topic that has kind of like taken off in the last few years. Before perio was see a pocket,
That's
cure
right.
a pocket. Today we have moved into aesthetic considerations of perio. What is the philosophy, the way you look at this aspect of periodontal therapy?
Sure. Well, in general, my philosophy is like in any field, any area in dentistry, do not harm the patient. Treat the patients like if they were part of my family, if they were a friend. So that's my philosophy. In terms of periodontics, as you can tell, my thinking is to be in a progressive. So I've been involved with post-graduation training, perio, ortho, in dental implants. So even though I still do conventional periodontics, like conventional open flap surgeries, gutted tissue regeneration, bone grafting, tissue grafting, gingivectomies. But nowadays, as you mentioned, since the advent of aesthetic treatments and dental implants, our periodontal procedures have become more detailed in order to deliver to the patients that are asking for aesthetic procedures. Patients, they want to improve their function and aesthetics,
And the appearance, yeah.
so their appearance. So our periodontal procedures have gone through a period of improvement. So we have newer techniques, we have newer materials that we utilize.
Yeah, and I am assuming that with your orthodontic experience,
That's right.
you can generate new bone levels and change the patterns in order to get a much better result, not only periodontally, but when the patient is ready to be restored, then the patient will end up with a fantastic,
Sure,
not only
yeah.
functional, but aesthetic result.
That's now I realize, it became very handy to know about ortho, Because like in the implant dentistry now, many cases you have to move teeth. Then you have to mend bone and then place the implants.
Perfect.
So, yeah, you're right.
Yeah.
And actually on my residence at Loma Linda, we are doing some ortho.
Oh, fantastic!
treatments,
So you're
We are.
getting your residents into doing some of their own ortho, so they can get a better understanding, and hopefully, when they are out and decide to become just limit to periodontics, they'll be able to communicate with the orthodontist or the general dentist that does ortho their needs to, as a team, create a fantastic result. Mario, you're talking about the newer and different techniques that we have today in periodontics in order to create better function and better aesthetics. Also, we know that a lot of general dentists, I mean, the levels of education and skills that they have, it's phenomenal, and more are starting to coming into doing a lot of periodontal surgery in their own practice. What are the techniques that are the most common periodontal aesthetic techniques that you like to teach, that you would recommend general dentists to start practicing and starting getting, the confidence necessary to move to the next step?
Sure. Again, nowadays we have many patients that they want to improve their appearance, their aesthetics. So periodontal treatment can help a lot those patients. We do, as I mentioned before, we still do conventional periodontics, but nowadays we can do treatments like aesthetic crown lengthening. So we can improve the gingival tissues of the patients. Sometimes we add tissue, sometimes we remove tissue. So aesthetic crown lengthening is a very, very rewarding procedure. We do tissue grafting. We can do connective tissue grafting, the so-called traditional free gingival grafts, or we can use these alternative materials like allografts. They are available in the market. Many of our young ortho patients, they do need free gingival grafts in order to improve their gingival condition.
The quality of the soft
Before
tissues.
we start moving teeth.
Yeah, this is actually very important and very interesting because there is a difference between a connective tissue graft and a free gingival graft, and they both have a place in perio, and many times because connective tissue grafts have become so popular, and I mean they are the best to do root coverage.
That's right. Yeah, that's right.
Some people do connective tissue grafts instead of a free gingival graft when the free gingival graft was more indicated.
Sure. And obviously, on this occasion, we're not going to expand on the differences, but yeah, you're right. That's what I mentioned: connective tissue grafting, free gingival grafts. There will be a time where we can go
and
over.
These are all the
explain all the different procedures, all the different tissue grafting.
This is what you cover in your courses.
Sure. Yeah, that's what we are covering. We are covering also suturing techniques. Very, very important too. Yep. Extrusion of teeth before implants or for teeth. We teach functional crown lengthening for a proper restoration. We don't want to see bleeding gums because we invade the so-called tissues. So we teach that, so that's part of cosmetic aesthetic procedures.
Create the proper biological conditions to receive a good restoration that will last forever. Well, nothing lasts forever, but will last for a long time, and will give the patient good service without causing all this inflammation that we see sometimes due to lack of creating proper biological conditions.
So as far, Dr. Dana, as what can GPs do, basically they can do any or most of the periodontal procedures as long as they have good training.
Absolutely.
They have knowledge, they know how to select cases, and that's why it's very important, continuing education, hands-on training.
Absolutely. Like you said, case selection is one of the most important aspects of success. And when you don't select your cases properly, your procedures are not the correct one, and you end up with problems.
So another of the procedures that we doing a lot nowadays with the advance of dental implants will be improving the quality of the tissues of the dental implants. Because now we know for the long-term health and stability of the implants, they need some free soft tissue grafting.
Good quality,
So
yeah, that is
we
absolutely
are
right.
going to be covering those.
And yes, I know that's part of what you cover. I have actually learned from you, and my implants procedures have changed. Many times I create a better tissue condition by doing a graft, whether it's connective or free gingival, before I go and put my implant, and I see the results are much better. And I know that you cover that in your courses. That is fantastic. Uh, what what are the most common challenges that you see the general dentist having when they are doing periodontal procedures in their practice?
As I mentioned before, with proper training, case selections, general dentists should be able to know when to refer. But most of the periodontal procedures can be done in a safe way, in a safe manner. Of course, we know we have some patients, like maybe they have like compromised situations or heavy smokers, diabetes, patients with heart conditions that they're probably going to bleed a lot. So, being prepared, maybe get a medical consultation before we treat the patient, so we can overcome those challenging situations.
What do you think is the most challenging thing about aesthetics? And I'm talking in general, because the patient that comes with aesthetic desires, aesthetic needs, will need you as a periodontist, will need you as an orthodontist, and will need a restorative dentist to put everything together.
I feel like fortunately here at POS, we get to meet great doctors. And then if the general dentist feels like they need the help from other specialties, that's what will be my advice. On complex cases, just get the help of other specialists, other doctors. And but again, the majority of the cases, they should be able to be treated in a general practice.
If I hear you right, is get a clear communication with other colleagues, specialists, experienced doctors, and work the case to your level of expertise, and what's outside of your level of expertise with good communication. Have your colleague, whether it's specialist or not, complete the case, and with good communication it will mesh up into beautiful.
Yeah, that's why I recommend, for general doctors, young doctors, to begin taking continuing educations where they have hands-on. They can start with, I'm not going to say simple cases, they're not really simple, but not too complex, not too difficult cases. Yep. And then, to build up, to get the skills necessary to perform the best.
Yep, absolutely. And actually, your courses have a lot of hands-on. I've seen them. They get to do grafts on pigs or sheep jaws, and they get to do flaps and so on. And they are actually, I've seen them, and they are actually fantastic.
It is a very good way to start. Getting, to feel the sutures and the tissues. So you don't have to go straight to a patient to do your first procedure. You can start with the hands-on.
Yep.
I really recommend that.
That is absolutely true. Mario, it's been a pleasure having you here. It's really fantastic to have such a good friend for Progressive Orthodontics seminars, such a good doctor giving us all the support and bringing all your knowledge into the Magan postgrad lectures, and of course training not only dentists out here in California, but now training doctors at the Magan International School of Dentistry at Primas in Indonesia. It's been a pleasure to be with you. Thank you very much.
It is my pleasure to be here.
Thank you.